Hi there. Welcome to the overview of your medical scheme benefits for 2025, brought to you by NMG Benefits. This video highlights and summarizes the various options available on Momentum Health. NMG is an authorized financial services provider. NMG staff are fully accredited with the FSCA, the Council for Medical Schemes, and your medical aid. As one of the largest financial services intermediaries in South Africa, with more than 30 years of experience, we can assist with various elements of your medical scheme and provide you with independent advice on the most appropriate option. In this presentation, we are going to take you through the three main components of your medical aid, provide you with an option summary, take you through the wellness program benefits, and lastly, look at the monthly contributions for 2025. Let's move on to the overview of the three components of your medical scheme: hospital cover, chronic cover, and day-to-day cover. Hospital cover is the most important element of your medical scheme. Hospitalization is unlimited on all options at Momentum Medical Scheme. The actual rate at which you're covered for treatment in hospital will vary by your plan choice. This rate is reflected as a percentage of the scheme rate and will increase from 100% cover to a higher percentage depending on your plan choice. Planned hospital procedures need to be pre-authorized with your medical scheme by contacting the scheme on 0860 117 859. Your doctor may do this on your behalf or may give you the necessary codes and descriptions to obtain the authorization yourself. It is recommended that members carry their membership cards with them at all times or download the digital card. Members on certain plans may need to make use of network hospitals in the case of planned procedures. Please be aware of the day surgery network where certain procedures must be performed in one of the designated day surgery clinics to take advantage of the reduced co-payments. Momentum Medical Scheme gives members the opportunity to choose between any hospital or associated hospitals on the extender, incentive, and custom options. Choosing associated will result in a premium reduction, and members must make use of an associated hospital network for planned procedures. Use of non-network hospitals on the associated, Evolve, or Ingware plans will incur a 30% penalty co-payment on the hospital account. It is becoming more important each year to consider taking out gap cover. Gap cover is a short-term insurance product which can be purchased separately from your medical scheme and is an effective way to ensure that you are covered for hospital shortfalls. These shortfalls arise because there is no forced regulation on provider charges. Medical schemes may only cover up to a certain rand value or your medical scheme has co-payments and deductibles. Gap cover will assist in covering the resultant in-hospital shortfalls. Please contact your NMG consultant to discuss the gap cover options available to you. Let's move to your chronic cover. All plans cover for medication relating to 27 chronic conditions which are paid from risk. Certain plans have an additional list of chronic conditions that will be covered, so it is important to understand this before you consider a plan change. By example, higher costing plans include cover for certain mental illnesses such as depression. A plan downgrade will result in the member having to pay for this medication from day-to-day benefits instead of the chronic benefit. Should you be diagnosed with a chronic condition, it is necessary for your doctor to contact the scheme to register your condition under the chronic benefit. This will ensure that your treatment and medication relating to the condition is covered by the scheme and will not affect your day-to-day benefits. Each plan has a chronic medication list, known as a formulary, to guide members on which medications are available on their plan. If you choose a medication that is not on the formulary, a co-payment may apply. Please chat to your doctor about the possibility of changing to a formulary medicine to avoid the shortfall. Momentum Medical Scheme offers 3 provider choices, namely any, associated, and state. Members who have chosen any have the freedom to use any pharmacy and get their script for chronic medication from any GP. Members who select associated must make use of MediPost as their designated service provider and obtain their script for chronic medication from an associated network GP. We generally advise members who do not have any chronic condition to select state as the network on this option, which allows the member to take advantage of the reduced premium. Members on the Ingwe option must make use of the Ingwe Primary Care or Ingwe Active Network. Members on Evolve will need to make use of state facilities. Please note that chronic medicine formularies differ based on your provider choice. Day-to-day cover. All Momentum Health members have access to comprehensive screening through the Health Platform benefit. Health Platform benefits are paid by the scheme up to a maximum rand amount per benefit. The scheme must be notified before you use this benefit. Members on the Ingwe and Evolve options only have these benefits available to them from their chosen primary care network provider. The Ingwe option offers primary health care through network providers. Members do not have access to a savings account. Momentum offers members a hospital plan called Custom. No day-to-day benefits are available on this option. The incentive option offers members a 10% savings benefit to cover day-to-day medical expenses. Members on the extender option have a rich savings account. Once savings is depleted, they will be subject to a self-payment gap where claims will not be refunded by the scheme. Once the above threshold level is reached, additional benefits will be available to them for day-to-day expenses in the above threshold benefit. Now that you have a better understanding of the key components of your medical scheme, let's take a closer look at the options that are available. The Summit Plan is a traditional option which covers hospitalization at any private hospital at 300% of the Momentum rate. Extensive chronic and day-to-day cover is available from any provider. Day-to-day cover is paid from a risk benefit subject to an overall day-to-day limit of 28,000 Rand per beneficiary. This is a combined limit incorporating both day-to-day cover and cover for 36 additional chronic conditions. The extender and incentive options provide private hospital cover at 200% of the Momentum rate. Members have the option to choose their hospital and chronic provider networks across the extender, incentive, and custom plans, and will enjoy premium reductions as a result. Members have access to medication for 62 chronic conditions on extender and 32 on incentive. Day-to-day expenses are funded from savings on both extender and incentive, with the extender offering an above-threshold benefit once savings is depleted and members have paid through their self-payment gap. The custom option is a hospital plan offering cover at 100% of the Momentum rate. A co-payment of R1,830 is payable for most admissions. Members have access to medication for 27 chronic conditions on the disease list, but no day-to-day benefits are available. The Evolve option offers members private hospitalization at 100% of the Momentum rate. Members must make use of network hospitals in the case of planned procedures. A co-payment of R1,830 applies to all admissions. Members have access to medication for 27 chronic conditions on the disease list. However, this is obtained via the state network. Members have a choice to make use of the Health Saver to increase their day-to-day cover even further across all these options. Health Saver is a complimentary product offered by Momentum that lets you save for medical expenses. The Ingwe plan provides unlimited hospitalization at the agreed rate, depending on the chosen network, and contributions are income dependent. Members have access to medication for 27 chronic conditions on the disease list. Benefits are available from the Ingwe Primary Care Network or Ingwe Active Primary Care Network, depending on the member's choice. If a member is on the Ingwe Connect option, chronic benefits are managed through state facilities. Day-to-day cover can be obtained from the member's Ingwe Primary Care Network provider. Members on this option also have access to the Health Saver benefit. Let's take a look at Momentum's Wellness and Rewards program. Multiply is a comprehensive loyalty program encouraging members to be healthy and active, and in return, offer them rewards for their efforts from various Momentum partners. In 2025, members can take advantage of a digital health and fitness assessment. Members also have access to WISA, 24/7 confidential support with mental health, and continue to enjoy rewards from the Multiply partners. Ultrahuman, Travel Start, Puma, and Multiply Paddle have been added as new partners for 2025. Let's take a look at the 2025 contributions. As advised, the Ingwe option is an income-banded plan. This means your contribution will be based on your gross monthly salary. Although we make every effort to get things right, there may be times when you feel that you have not received the level of service you are entitled to. The complaints procedure can be downloaded from www.nmg.co.za. We trust that you have found the video informative and that we have shed some light on the Momentum offering. Thank you.